Yeah, we look at it a little differently. So I think it is so naturally embedded into the idea of entrepreneurship, particularly in Silicon Valley. I think technology is certainly the biggest disruptor of our lifetime. So we see technology as, the social disruptor in a great way. We don't look at technology innovation or just looking at pure technology as from a product perspective as as a focus for our investments. We really look at what can technology do to help solve these big problems. And we're seeing the use and the creativity and the application of technology just floor us in terms of how mobile is being used, how different aspects of tracking and mapping, whether it's Google Earth technologies or whether it's customized applications that people are building on their own to track oceans or fish stocks. It's super exciting, and it definitely is accelerating the learning and the data that's available to these entrepreneurs. And so it's hugely important for us to be not only tracking and investing in, but really working with our social entrepreneurs to help them adapt and be able to use technology in new ways. So we see that as a fundamental part of what foundations can do, is help social entrepreneurs who may not have a lot of technical capacity, but absolutely have to be thinking about how technology can help their work. So one organization that I think comes to mind in terms of the use of technology is an organization called Medic Mobile. So it was started by a guy who was a kind of typical Silicon Valley, went to Stanford. He was actually studying to be a doctor and went out into the field, in this case it was in Africa, to look at how medicine and how access to medical facilities in rural areas was being done. So when his name is Josh Nesbitt, so when he went out to the field and looked at how a community health worker, so when there's not doctors and nurses widely available, community health workers is a model that helps bridge that access from a rural village to a medical clinic or to a hospital, right? So when Josh, this Stanford student who's studying to be a doctor, went to a village in Africa and looked at the community health worker who was walking up to hundreds of miles a week to track his patients and bring that data back to the clinic, he realized, and he looked on his cell phone and had 4 bars of cell service, that he said he should be using a mobile phone to input this information, not walk to the hospital, but send it back to the hospital and medical clinic, and he could see many more patients. So they started to look at how to develop applications, not for the sake of selling them as a for-product offering, but designing mobile applications for community health workers and customizing that technology to be able to help accelerate and basically reduce the costs of what it was taking to get those medical records, to improve the outcomes, so more patients were getting better health services more quickly, and ultimately able to show the results because this data was now in a database and online and accessible to others, and so he could also share that with other funders and with other clinics nearby, and to show what was working and what they were challenged by. So that is an example of technology, adapting technology for the sake of improving the social situation that we really look for and want to support. There's a great organization called Ushahidi, and they're not in our portfolio, but they're a partner, and we look at, so they, during the Haiti earthquake, it was started by some very smart folks in a college dorm room that said this global atrocity is happening, how can we help? And they said, well, we know how to map, we know how to code, we know how to do SMS, could we figure out a way to map and create and contact, and they had a couple people they knew in Haiti, and they said, well, could we map where there are big needs, like could we create an SMS system and a mapping system that would help people who are in Haiti say, I need help here, or there's children trapped in this building here. They developed it pretty quickly and turned around in days what then the U.S. government was using for real-time information about where people needed resources and help. They were able to map the country. They were able to look at which, again, get local input from people on the ground, and then broadcast that in a way that really helped others, direct resources and funds. So as an example of a use of technology in a way that was really real-time, absolutely essential, and was a gap, so the government didn't have that kind of capability, and also was open. So it wasn't a proprietary system that they were trying to control and sell. This is an open system that people can use. So now they've broadened that to whether it's other countries or other disasters. They've become really known for their ability to create technology systems like that really help people when there's a real-time crisis. Scale can mean a lot of different things, right? It can mean great reach, but if the quality of that reach is not effective, then you're not helping crack open or solve a big problem. So for us, it's not just about the scale or reach of a particular innovation or an organization. We really look for, we call it equilibrium change. So for us, and that's just a fancy way of saying, what is the status quo now? And what, if we apply this innovation, if we help that innovation grow via partnerships and ecosystem support, what is the new status quo, and how do we sustain that new status quo? So for us, and that status quo could be a way a village is operating on the ground and has been for many, many years, but it really is about ending a human rights abuse within that village, or that then could spread. Or it could be a massive change in the way fisheries are being tracked and illegal fishing is being done, right? So for us, it's not just about scale, but it is about that status quo sustainability. Like if there's this new, and it has to be enough that it's not just in a one example in one place, but can it be duplicated in other places? Can it grow? Can it really be something that scales to change a broader status quo? Often in philanthropy, you can get lost. These issues are so complex. The challenges are so great. The funding is always never enough. So how do you focus in on the right investments that really do have the best chance to succeed? And how do you take enough risk that's a reasonable or informed risk along the way? For us, the equilibrium change means really understanding the current status quo. So as we look at social entrepreneurs who are doing, again, groundbreaking, disruptive work, they've looked at a problem from a very unique angle. They haven't said, oh, yeah, we need to solve this particular health issue in a standard way. They've said, this whole system is broken, and we can do something radically different that could shake everything up and make it better. So that equilibrium, so the current status quo and the beneficiaries in that model, so whether there's something keeping it in that status quo or in that state, and it might be corruption, it might be the markets, it may be just cultural beliefs and behaviors. So how can we look at that, disruption from the social entrepreneur, able to say, okay, we're cracking things open a bit, and that status quo this is our vision of where the new status quo is. And we're already seeing progress. We're seeing a pull of this, innovation or this traction of, hey, you know what? And whether it's ending child marriage, where today it's a very deep global problem, and we're seeing a lot of activism around that right now. And we're saying, okay, the new status quo would be there is no child marriage. And what would that look like? And what would need to be changed? And for us, that is where we get excited about concentrating on a vision, talking about the solution, not just the problem, but the new way of being, if you will, and what different roles of the sectors can take on to make sure it's sustainable. So there's, I think, many examples over history that have kind of looked at, and the hard part is sustaining it. So it can't just be one policy change that you bet on or one particular innovation on the ground in one place. It has to be an ecosystem approach.